Well, as the federal government distributes the vaccine, President Trump says it's up to governors to get the shots out to their residents. This is the highly contagious UK strain is now in the U.S., with the first case appearing in Colorado. So how will that state plan to stop the spread? Let's ask Colorado's Democrat Governor Jared Polis. Governor, great to see you. Thank you very much for being here. Happy New Year. We are all concerned, of course, about this faster spreading version of COVID. What's the latest on your ability or inability to trace where it came from?
So, at this point, we were the first to find the variant here in the United States. It doesn't mean Colorado was the first to have it. We think it's probably in most states. They've since found it in Florida and California. It's not yet the prevalent strain, meaning as we detected and looked at the strain of a number of folks who had coronavirus, and sadly, we have 2,000 or 3,000 a day here in Colorado coming down with coronavirus. It's still just a minority of cases. We've just found 2 tentative identifications, 1 confirmed. We expect to confirm the second soon. But what happened in the United Kingdom, David, is it very quickly, because and this is what led to the conclusion that it spreads more quickly, it very quickly became the dominant strain in certain areas, crowding out other strains because it was more contagious.
Well, have you been able to find out whether it was something that mutated here in the United States, that grew organically in the U.S., or was imported from the U.K.?
Most likely the latter. I don't think scientists will know definitively for some time, but it's unlikely, I'm told, that a identical strain would mutate twice the same way. So there's a lot of commerce and travel between the United States and United Kingdom. People go back and forth between New York and London and San Francisco and Denver and Texas and London almost every day. So it's no surprise that it wasn't kept successfully isolated there.
Well, thank God we have vaccines available, but there are problems with the vaccines. We've got about 12 million doses that have been made so far, a lot more coming online. But of those 12 million doses, I'm told only about 2.8 million have been administered. Where are the log jams?
So the vaccines are a godsend, thank goodness. And here in Colorado, we're prioritizing age 70 and up. People 70 and up are receiving the vaccine as we speak. It'll take about 4 to 5 weeks at current supply levels for everybody 70 and up to receive the vaccine. I'd put a couple points into that. Here in Colorado, what we did is we said anybody that we partner with to distribute vaccines, and that means hospitals, community health clinics, others, need to use every dose we give them within 72 hours, or we will reassign it to somebody else who will. So we had to use that kind of firm hand to make sure that the doses are getting out as quickly as possible. The other issue is a somewhat erratic weekly supply from the federal government. It's hard to book patients and know how many we're giving. When the quantities change, they're not like doubling or going in half, but when we get, it's 30% less, well, we have to cancel those appointments or roll them into next week and try to do the following week. So we're hopeful that there's more reliability on the weekly supply from the federal government.
Well, and again, thank God we have them. As you first noted, there is some irony here in that some governors, not you, but some governors like Governor Cuomo have objected to directives coming from Washington. He even formed his own little FDA, his state-run FDA, to approve of the vaccine, not trusting the one in the federal government. But when it comes to complaints about distribution of the virus, he's all for directives from Washington. There's a contradiction there, isn't there?
Well, I haven't been listening to what every governor's been saying, but I, for one, am very grateful that we have the flexibility to prioritize age 70 and up here. The CDC put out recommendations age 75 and up. What we found in Colorado is that 78% of our fatalities from coronavirus are age 70 and up. So once we get through that group, we can reduce fatalities by 3/4, and that's really why we're focused on 70 and up, and then we'll go to 60 to 69 after that.
Good for you. Good for you. I think most Americans agree that's how it has to be prioritized. Governor Polis, we wish you the very best in not only tracing this new virus or the new mutant, but in also getting the vaccines out. Thanks for coming in, and Happy New Year to you.
Always a pleasure. Happy New Year, David.
Thank you very much.